Malaria, a disease as old as time itself, continues to wreak havoc on the African continent. Despite decades of efforts to combat it, this mosquito-borne illness remains a formidable adversary, claiming countless lives each year. The malaria parasite, transmitted by the Anopheles mosquito, thrives in the warm, humid conditions prevalent across much of Africa. This deadly combination has created a perfect storm for the disease to flourish. The continent bears a disproportionate burden of the global malaria burden, with an estimated 94% of cases and 95% of deaths occurring in the WHO African region in 2022. Malaria is particularly devastating for young children, whose developing immune systems are ill-equipped to fight off the infection. In fact, children under the age of 5 account for approximately 80% of malaria deaths in Africa. The disease can lead to severe anemia, cerebral malaria, and even death. Beyond the human cost, malaria also has a significant economic impact on Africa. The disease reduces productivity, hinders economic growth, and drains resources that could be allocated to other essential services. The loss of lives and the burden of healthcare costs associated with malaria are a heavy toll on African nations. Malaria is often referred to as a silent killer, because it can strike quickly and unexpectedly. Symptoms can be mild at first, but they can rapidly deteriorate, leading to severe illness and death. The lack of early diagnosis and treatment can exacerbate the problem, as the parasite has time to multiply and spread throughout the body. Despite the challenges, there is hope. Numerous organizations and individuals are working tirelessly to combat malaria in Africa. These efforts include mosquito control, strategies such as insecticide-treated nets, indoor residual spraying, and larvicides are being used to reduce mosquito populations. Early diagnosis and treatment, rapid diagnostic tests and effective antimalarial drugs are essential for treating the disease and preventing its spread. Vaccine development. Researchers are working to develop a malaria vaccine that can provide long-lasting protection against the disease. Public health education. Raising awareness about malaria prevention and treatment is crucial for empowering communities to take action. Our Islamic charity is committed to making a difference in the fight against malaria. We believe that every life is precious, and no child should suffer from a preventable disease. By harnessing the power of cryptocurrency, we are able to provide timely and effective support to malaria-affected communities in Africa. Our approach involves funding essential services. We use crypto donations to fund the purchase of mosquito nets, antimalarial drugs, and other essential supplies. Supporting malaria vaccination. We are doing our best to provide a regular schedule of nationwide vaccinations. All human lives are important. Supporting community-based initiatives. We partner with local organizations to implement community-based malaria prevention programs. Advocating for policy change. We advocate for policies that prioritize malaria prevention and treatment at the national and international levels. The malaria crisis in Africa is a complex issue that requires a multifaceted approach. By supporting organizations working to combat the disease, raising awareness, and advocating for policies that prioritize malaria prevention and treatment, we can make a significant difference. Follow the link in description to help people in need. It is time to unite against this silent epidemic and create a future where malaria is a thing of the past.